Operation Skip Trace was initially kicked off by a tip from California DHCS, Department of Healthcare Services, of a tip of alleged hospice fraud at 14 companies. DOJ's DMFEA, the Division of Medi-Cal Fraud and Elder Abuse, my team, investigated those 14 companies, plus a billing company, and 8 individuals suspected of money laundering. We found that those involved in this fraud, in this scheme, would purchase personal identifying information for people who live outside of California on the dark web, and then enroll them into covered California, posing as California residents. Straw owners then bought up a number of hospice companies and began billing Medi-Cal for non-existent services for those stolen identities. They used fake records, non-existent offices, and fake diagnoses to justify these claims. Meanwhile, the so-called patients were healthy, out of state, and completely unaware that they had been enrolled in hospice care. Once the money was paid out, it was funneled through a complex web of over 130 shell companies and hidden across bank accounts, payment apps, and cryptocurrency to evade detection. The money was laundered. As I said, the scheme racked up approximately $267 million in fraudulent billing. So far, our team has already recovered more than $30 million, with more to come, and we worked with DHCS and the Controller's Office to stop checks worth more than $40 million. This scheme, this criminal operation was no accident. It wasn't a case of billing errors, cutting corners, or upcharging care. This was a brazen, calculated criminal scheme that exploited the Medi-Cal system, stole from the state of California and Medicaid, and prevented services and care from going to sick individuals who actually need it. We've put an end to this fraud, and we intend to prosecute the perpetrators to the fullest extent of the law.